Hi everyone, welcome back to our channel. I'm Bonnie, and today we're exploring the factors that affect drug distribution within the body. Distribution can depend on many factors, including the physicochemical properties of drugs such as solubility, pKa, and molecular weight. We'll also look at the effect of blood flow to organs and tissues, capillary permeability, transporters, and tissue affinity. This video will describe how these factors influence drug distribution, and we'll conclude with a brief discussion on how changes in volume of distribution impact half-life and time to steady state. Let's dive in. Drugs with greater water solubility are less capable of dissolving and diffusing across the highly lipophilic cell membrane and may require a transporter protein. However, drugs that are lipophilic are not as readily distributed into the watery environment of the blood. Lipophilic drugs are more likely to distribute into fat cells than hydrophilic drugs. This can create pooling of drugs within fat stores, creating a reservoir of drug. These reservoirs are gradually released from the store as the drug is cleared from the circulation. This can prolong the action of a drug, particularly if the capacity of a particular tissue to store the drug is high. It may also take repeated doses to build up a sufficient drug concentration in the plasma for the drug to then act on the desired target cells. The pK determines the pH where 50% of a weak acid or base is ionized. When ionized, weak acids and bases tend to be more water-soluble. When unionized, weakly acidic or basic drugs tend to be more lipid-soluble. Tissue fluids are typically more acidic than blood and extracellular fluids. Therefore, weak acids tend to be more ionized in blood vessels, leading to the drug being trapped in the central compartment as the ionized form is unable to cross the cellular membrane. Conversely, weak bases tend to be more ionized in tissues, leading to drug being trapped in the peripheral compartments. The molecular size of a drug may limit its penetration into various tissues. Typically, this affects only very large molecules. For example, unfractionated heparin, which at approximately 15,000 Daltons, is generally confined to the plasma with an apparent volume of distribution equal to 0.06 liters per kilogram. Conversely, chloroquine is approximately 319 Daltons and distributes extensively throughout the body. The apparent volume of distribution for chloroquine is 200 to 800 liters per kilogram. Blood flow and perfusion of organs and other tissues is particularly important for the distribution of medication. In cases where the drugs rapidly diffuse across cellular membranes, blood flow can be the rate-limiting step in the distribution of a drug. Naturally, there is huge variation in blood flow throughout the body. Some tissues, such as the brain, kidneys, and liver, receive greater amounts of blood flow. Conversely, the skin and adipose tissue tend to receive lower amounts of blood flow. Accordingly, you may expect a drug to distribute at a greater rate and to a greater extent into tissues receiving more blood flow. However, it should be acknowledged that this does not always hold true, as blood flow is just one of many factors governing distribution. In practice, changes to blood flow may be clinically important. For example, medical conditions, such as congestive heart failure and shock, may impair blood flow, resulting in a lower rate and extent of distribution. In most tissues, the endothelial cells present in the capillary membrane are quite leaky, particularly in organs like the liver, bone marrow, or spleen, which are perfused by sinusoidal or fenestrated capillaries. Most small drugs can readily permeate the capillary membranes easily, facilitating greater distribution. In some organs, such as the central nervous system, the endothelial cells are not as leaky. For example, the central nervous system is protected by a blood-brain barrier, a selective, tightly packed, semi-permeable membrane. This makes distribution of a drug into the central nervous system much less likely. However, conditions that cause inflammation, such as meningitis and sepsis, may increase capillary membrane permeability, thus increasing drug distribution. Transport proteins, such as PGP, play an important role in the distribution of drugs within a cell or within a specific region of the body. Certain transporters can facilitate entry into tissues that are protected by tightly packed endothelial cells, such as the blood-brain barrier. Other efflux transporters, such as PGP, remove drug from the cell to minimize drug accumulation. Drugs that inhibit or induce PGP have potentially clinically significant implications for the distribution of drugs that normally have their distribution affected by PGP. Similarly, the distribution of drugs may be affected by interpatient variability in the expression of these transport proteins. Accumulation of drug into tissues depends on the blood flow and the affinity of the drug for the tissue. Drug affinity for the tissue depends on its lipid solubility and binding to tissue components, such as receptors. Generally, drug uptake into a tissue is reversible. The drug concentration in a tissue with low capacity will equilibrate with the plasma drug concentration rapidly and will decline quickly as the drug is eliminated from the body. However, drugs with high tissue affinity tend to accumulate or concentrate in tissues that have high capacity. In particular, very lipophilic drugs tend to accumulate in adipose tissue and only slowly leach out. Considering the poor perfusion of adipose tissue, drug accumulation takes some time. However, once a drug is concentrated in adipose tissue, removal can take a long time and act as a reservoir of the drug. For example, the insecticide DDT is highly lipid-soluble and remains in fat tissue for years. Drugs may also accumulate in tissues by binding to proteins or other macromolecules. For example, digoxin has a high affinity for proteins in cardiac tissue. As a result, digoxin has a large apparent volume of distribution. Conversely, drugs may have a high affinity for plasma proteins. When the affinity for plasma proteins exceeds the affinity for other tissue proteins, most of the drug tends to stay in the plasma. As a result, the drug may have a low apparent volume of distribution. The affinity of drugs for plasma proteins will be discussed in our next video on plasma protein binding. Generally, a higher VD is associated with a longer half-life and, subsequently, a longer time to reach steady state. This may delay the time taken for the clinical effects of the drug to become apparent, and the loading dose may need to be altered. The equation provided describes the relationship between half-life and VD. It should be noted, however, that a change in VD may not always result in changes in half-life. If there is a compensatory change in clearance or CL, the half-life may remain unchanged. For example, if the VD of a drug is increased but clearance also increases by a similar magnitude, the half-life may not increase as one would expect. Thanks for watching. If you found this video helpful, please give it a thumbs up and subscribe to our channel for more insights. In our next video, we'll be discussing plasma protein binding, another important topic in pharmacokinetics, so make sure to hit the notification bell to stay updated. Until then, take care and stay informed.